love note when I do something or leave something like that. Let's start by reviewing tooth numbers. I don't want you to forget. You see over here on the side? Let's do the hard ones. Okay. What tooth number corresponds to the primary maxillary left first molar? We use letters for primary. Pardon?
Can you repeat it, please?
Sure, I can remember it. Primary maxillary left first molar. Yes, ma'am.
Is it I?
It is I. Good job. Everybody get that? Okay. How about the mandibular,
Okay. Thank you.
sorry, primary mandibular right canine? Okay, R, we'll do another one. Everybody got that? R?
Was which one? What was it? R is which one?
Primary mandibular left canine. Okay. No.
So is it the first 20 letters of the alphabet that you're asking us to match with our C, with the 20 primary?
Correct.
Okay.
Yep.
Okay. Just wanted to clarify.
AJKT. And the way I remember that is I worked with 2 sterilization assistants. One was AJ and the other was Katie. So second molars are AJ on the maxilla and second molars on the mandible are KT. Okay? And then I try to remember canines to kind of break up the arches so I can fill in the letters easily, but I have to confess I have to think about primary because I just don't use it that often. Okay? Let's do another one. How about a primary, maxillary, central incisor?
Sorry.
Okay. Kelly?
I'm thinking that it's F.
That would be a left one. I don't think I gave you a side, did I? So, yep, E and F would be the right. Can I help you with something?
No, we're
Okay.
counting on it.
Okay, okay. Well, you can make, one of these, just like I did on the other side. And just start labeling. Okay? All right, let's do a permanent tube. How about a permanent maxillary left lateral incisor? It's Alexis, right? Alexis? Left, yes. Good. How about a permanent mandibular right second premolar? Tell me your name.
Nikki,
Nikki.
would it be 31?
Premolar, not molar. So just back up to,
So 29.
yes, number 29. How about a permanent mandibular right
more?
One more.
Oh, sorry, 25.
That's okay.
I lost count.
Yep. So go home and study those, okay? When we get to tooth anatomy in a couple of weeks, it'll be a whole lot easier, okay, Nisa?
So with primary teeth, we use letters and
Yes.
Okay.
A through T. So A through T in the universal system for primary teeth, 1 through 32 for permanent teeth. And the lettering goes the same way. You start at quad 1 and you finish at quad 4. Okay? We'll keep working on that. That was just to wake you up. Okay, so I'm trying to plan out a calendar for the rest of this course, believe it or not. We just started week 3. Was that a sigh of relief or sadness because you're loving this class so much? So we are done on May 11. That'll be your final exam. So this is the way I see it. So Monday the 26th, we will start chapter 12. The 27th is chapter 13. 28 is chapter 14, and that's the end of unit 2. I don't like giving you exams the day after I present new material. So I will probably give you exam 2. Ugh. Well, on the 3rd of May. However, on the 29th, we'll probably start unit 3. Okay, so you will, unless you want the test the next day. I try to give you the weekend to study, but I have to start the next unit before. Yes, ma'am?
So if we do it the 3rd or the 29th, though, we'll be learning information that doesn't apply at all to the test.
Sure it does, it all comes together, but
But-
yes. Yep. I don't know what else to do unless you want to take a test in off class hours. Okay, so then on the 3rd, after the test, we will start we'll start unit 3 on the 29th. We'll continue on the 3rd after the test. We'll finish by the end of the week. It's shorter, and really I'm gonna give you some tooth models to look at. I'm gonna talk about the structures of the different tooth types, and that's primarily what unit 3 is. Okay, it's hard, but not as much material as these last 2 units. And then I would like to give you the test on May 6th, so that on the 10th, which is Monday, we can have a review, and then on the 11th, we have the final. I think that's my plan, okay? That's my plan right now. Yes, ma'am?
So there's not technically a final for just this class, it's the final for those classes, is that right?
I'm not understanding your question.
It's, never mind,
Because it's a 5-week class, I'm given absolutely no, or you're not given any study days the way you would at the end of the 10-week course. So, I tried without asking once and gave my exam a little bit later, and I got into a lot of trouble, so final exam has to be on the 11th, okay? So that's the plan. Okay. So yesterday, we started talking about tissue types. We talked about the 4 basic tissue types that animals are made up of, including humans. And we started talking about cellular connections. That we're at the end of chapter 7. And what were they called?
What was the question?
What were the cellular connections that we talked about that were at the end of chapter 7?
Collagen fibers?
How about the cell-to-cell connections that are made up of plaques, transmembrane proteins?
The desmosomes and
There we go.
desmosomes?
Yep, so the desmosomes and hemidesmosomes. What's the difference between the two?
Fat. Hemi is fat.
Okay, do they attach to the same things?
Yes.
So desmosomes attach cell to cell. Hemidesmosomes, which are half, attach cell to non-cellular tissues. And we talked about an example in the oral cavity of a hemidesmosome attaching a cellular structure to an acellular structure. Do you remember what that was?
The gingiva sulcus, the junctional.
So the enamel is attached, the enamel is the acellular structure, and it is attached to the junctional epithelium, which is part of the sulcus that we talked about. Remember that? Okay. Then we started talking about epithelium and its composition. And I just get too breathless, you guys. Sorry. We said that the most superficial layers of epithelium or skin are the most superficial layers of skin and oral mucosa are epithelium, right? And separating the epithelium from the connective tissue, what is that acellular level or layer called?
Basement membrane.
Basement membrane. And we had 3 layers of basement membrane. Who can tell me what they are? Raise your hands. Samantha.
Sorry. Okay, so that's where I got confused, because it was the basal lamina, right?
Uh-huh.
And that subdivides into the lamina lucida.
Lucida, uh-huh.
Lamina
Densa.
Yeah,
Yep.
and then it goes to the rectangular.
Reticular lamina, really good. So we said that the basal lamina, which as Samantha said is composed of the lamina lucida and the lamina densa, is made by the overlying epithelium. And that layer is attached to the epithelial cells by way of hemidesmosomes, right? And then we said that the reticular layer, which is deep to the other 2 layers, is formed by the underlying connective tissue. And that has a particular attachment. Do you remember what it looks like? I know I'm not boring, it's just that time of day, right? Yes, ma'am.
Attachment flap?
No, it's those spaghetti-like structures. They're filaments that are produced.
Is
Nisa,
it the tonal filament?
that's from the desmosomes and the hemidesmosomes. Rachel? Sorry? Oh, well, I'm glad you're remembering that. No, we're on track here. That's good. It is those filamentous structures that are within,
Is it collagen?
they're collagen fibers, yes. So they are produced by the underlying connective tissue, and they are present in the reticular lamina, and that keeps that part of the basement membrane connected with the underlying connective tissue. Coming back? Okay, So let's list, oh, and then we talked about interdigitation. We looked at the purple fingers interdigitating with the pink fingers. So the purple fingers, Rachel, are called what? Reedy ridges, good. And then the pink fingers, which come from the underlying connective tissue, we haven't given a name to yet, but it comes from its papillary layer, so we call them papillary projections, okay? So those interdigitate, and what did we say that interdigitation does for those two tissues? Increases surface area, and how does that help?
Can absorb more nutrients.
It allows for greater uptake of nutrients, and it also provides strength for those tissues because, you know, they have a connection. And the problem with tissues not having connections is that when they rub around like this, they're not connected. Ulcerations can occur, infections can result, etc. And we'll get more into that in pathology next quarter, okay? So let's make a list of all the connections that we've talked about. You will be responsible for knowing all of them, what they do and where they are. So what did we say? What do we have? Say it loud. Desmosomes. What else? Hemidesmosomes. What else? Rachel?
Reed ridges.
Reedy ridges. What else? The papillary projections that I just gave you. And we said that those purple fingers, the reedy ridges, and the pink fingers, the papillary projections, are forms of interdigitation. Okay? Digits refer to your fingers. Okay? So you should know this list so far. Okay? And then we talked about extracellular materials, and we said there are two types. Do you remember what those two types are? Kelly?
Tissue liquid or
Tissue fluid, good,
fluid, which is the liquid of blood like plasma.
good,
The white blood cells.
yep. It carries white blood cells to an area of injury. What else? Whitney? Intracellular substance or ground substance, right? And what did we say that is? Ariana, do you remember?
Shapeless, gelatinous,
Yes. So it's a shapeless gelatin-like material that is between cells that serves as a protective barrier, and it also serves as a medium for gas exchange. Okay? We also said yesterday that epithelial cells are more tightly packed than the connective tissue cells, and so you're going to have more of those materials between the connective tissue cells in the connective tissues than epithelium, right? And we said there's a reason that epithelial cells are tightly packed together. Jocelyn, you remember why? For protection, good. It makes structures like the skin stronger when the cells are more tightly protected, or compacted, sorry. Okay? So that's what we talked, yes ma'am?
So you said connective tissue will be more tightly packed than
No.
epithelium?
No. Connective tissue has more extracellular material between the cells because the cells are less tightly packed together. Okay? And I think that's about where we left off. Any questions from yesterday? No? Okay. So now we're gonna talk about connective tissue, and again, chapter 8 is talking about tissues in a generic way, and then when we get to chapter 9 today, we'll talk about epithelium and connective tissue in neural cavity, okay? Question?
Yeah, whenever you said the two types, you said tissue fluid and the intracellular substance, those two types of what was the word?
Extracellular material. Okay, and the book uses matrix also interchangeably with extracellular material. A little confusing, but, okay. So we just talked about, there's the word matrix, okay, extracellular materials or matrix. So, now you know. And we said that connective tissue, just like epithelial tissue, is renewable. And we talked about regeneration, and we talked about turnover time. Are we good with those concepts? You know the difference, right? And we said that which tissue has a faster turnover time? Epithelial cells turnover faster than connective tissue cells. So if you have an injury in the epithelial tissues, that will heal faster than an injury or cut in the connective tissues, okay? Okay. We also said that epithelium is not vascularized. No blood cells or blood vessels, no lymph there. How do they get their nutrition? Ariana?
From the connective tissue below.
That's right. Good. Okay. I definitely need you to know that fibroblasts are the cells that make up or that produce connective tissue. Remember, it has a blast on it, so it produces something. Fibroblasts produce connective tissue. And they're kind of star-shaped, almost look like the stellate reticulum we looked at in the enamel organ. So this is what those fibroblasts look like. And in addition, within connective tissue, we have more intercellular substance and connective tissue fibers, okay? So this is within the matrix or the extracellular material. So we have connective tissue fibers. Okay, we're gonna talk about 3 types. Some minor contributions to connective tissue are gonna be white blood cells. You don't have to know all the names that are listed there yet. And this says other transient cells, so these other cells that they don't name come and go. When we looked at those fibers in the previous couple of slides, we said that there are going to be 3 different types of fibers that we need to know. The first is the collagen fiber. Oh, back up for a second. I wanted to mention yesterday when we were talking about extracellular material, and in particular, the intercellular substance or the ground substance. When I was getting ready for this lecture, I noticed in the reading that it says that hyaluronic acid is a component of that, which I thought was pretty cool. Have you seen the commercials with Kerry Washington advertising hyaluronic acid in the Neutrogena products, which I use? Do you know what that's for? Hydration, exactly. She's got is she in a shower or something, or she's got water coming down or in the background or whatever. So hyaluronic acid in those spaces between cells keeps the tissue hydrated. And you get a lot of that, or bigger concentration of hyaluronic acid in epidermis, which makes sense, and eyes, which I thought was interesting. So, just a little fun fact. Okay, so you can see these collagen bundles kind of look like rope, and that gives these collagen fibers their strength. So the basic composition of these fibers start with microfibers, And those microfibers are bundled into a fibril, and those fibrils are bundled into, this is considered one fiber, and then those fibers are bundled into a bundle. Okay, so that's what gives the collagen fibers their strength. That's what they're known for. Okay, and this just describes the composition. And then when they talk about different subcategories of the collagen fiber, we don't need to worry about that. Just know that type 1 is the most abundant in the human body. And again, that gives connective tissue its strength. We also have elastic fibers. Why would elastic fibers be important in connective tissue? Kelly?
Could it be for the epidermis on certain parts of the body to be able to expand?
Sure. You know, think about it. When you bend your arms, when you bend your body parts, you need that flexibility, right? And so, and also strength. So we'll talk about other uses of that as well. And then the last type are reticular fibers. Reticular fibers are present in an embryo and a fetus. We're not going to go into exactly how that works and why that is, but just know there are 3 types of fibers within connective tissue. We have the collagen fibers, which is the most abundant, and then within the collagen fibers, type 1 is the most abundant, okay? And then we have elastic collagen fibers, and then we have the reticular fibers. And I'm gonna go back for a minute, and we're gonna take a look at that picture of connective tissue. So once again, this is a cross section. This is what you see, well, this is what you see microscopically. But we have fibroblasts that make up connective tissue. We have the matrix or the extracellular material here. And within that extracellular material, we have fibers. And those fibers can either be collagen, elastic, a combination, or the reticular. Okay? Does this slide make sense now? Okay. And a couple of slides later, it said that within this extracellular substance, actually the matrix, you may have some white blood cells in there too, okay? But that's, the majority of the cells are gonna be the fibroblasts. We said fibroblasts are connective tissue producing cells, okay? Okay. When we talk about, and we mentioned this yesterday, when we talk about the 2 layers of connective tissue, those 2 layers together are called connective tissue proper. Okay. In the oral mucosa, those 2 layers are called lamina propria. And we'll talk about that again when we get into chapter 9, but just so you know, those 2 layers of connective tissue that are just deep to the basement membrane are called connective tissue proper. The more superficial layer of the connective tissue proper is that papillary layer with those, remember those pink projections, the papillary projections that we talked about? And then deep to that, we have the dense layer. The difference, as the name suggests, another name for papillary is loose connective tissue, and then deep to that is the dense. What would the difference be? Just as the name implies.
One's loose and one's
Say it loud.
not. One's loose and one's not.
Why?
One's deep and one's superficial.
One has more cells than the other. So the loose tissue is going to have less fibroblasts than the dense layer. Make sense? So let's take a look. Now this is a cross section of skin. And we know that because it says epidermis, dermis, and hypodermis. When we talk about the oral cavity, we're not going to see those words. Okay? They'll be different. So the most superficial layers. The purple, this pink, and then this top pink area are 3 layers of epidermis or epithelial tissue, okay? And then separating this purple layer from the underlying loose connective tissue or papillary layer is the basement membrane. Within that basement membrane, we already identified the 3 layers, right? And then deep to the basement membrane, first we have the loose connective tissue or the papillary layer, and then the dense connective tissue or the dense layer, and those 2 combined make the connective tissue proper. And then deep to the connective tissue proper in the skin, we have hypodermis. And just looking at that picture, what do you suppose the hypodermis often contains? Fat, absolutely. And then deep to the hypodermis, we're gonna find muscles. Okay? So you should know this basic structure of skin. And once again, this relationship between the purple fingers and the pink fingers is called interdigitation. About this, and this. And remember that the turnover time for those layers in the connective tissue is longer than in the epithelial tissue. Okay? Questions on chapter 8? Yes, ma'am.
The only thing, I'm understanding, the layers, I'm just not connecting the 2 things that connective tissue. Is that 2 things that combine to make the connective tissue proper?
Yes, 2 separate layers.
So the dermis and the epidermis makes it connective?
No, the epidermis is separate. That's part of the epithelial tissue. The connective tissue proper makes the dermis. Okay. So the dermis, even though it's part of the skin, the dermis is part of connective tissue and comes from mesoderm. The epithelial tissue makes up the epidermis in skin, and that comes from ectoderm, right?
Oh, hers says it too.
Yeah,
I was in and out, like that, the thought of that was not working out at all, like if I was in like nursing school and if someone
This is gonna take a second, so if you would like to take a restroom break, you're more than welcome. And keep it down.
I swear, thank you so much.
I literally can't believe for a second. What is she doing? I was just saying. Yeah, there, it was like, it's page 93. Yeah. So don't, you can keep reading in the chapter because it'll probably be beneficial later on her notes. It said just stop at 93. How do you? I I went to the U last night and we just had we just read a brief about everything and then it made more sense when she was going on. I don't know.
Yeah.
But she
Okay, let's talk about the oral cavity. Okay, when we do an intraoral, extraoral exam as part of your assessments, the reason that we do it is we say that often the oral cavity can be a mirror into the human body. So if there's pathology elsewhere in the body, often it shows up in the oral cavity. So this is in addition to all those superficial structures that you learned, you know, in chapters 1 and 2. That's why, so that you can identify those structures, so that you can recognize healthy from unhealthy, and you may help a patient by saying, no, this doesn't look quite right to me. I'm gonna send you to your MD or refer them to a specialist, and you may help a patient, you know, by saving their life. They may not know that some, pardon?
Have you ever caught something for somebody?
I've caught oral cancer.
Really?
And so these are the reasons that we're studying those structures, so that you can name them again, know the difference between pathology and normal, and you also need to be familiar with the histology of those structures, what might be going on, okay, underneath, so that you have an understanding of what to tell the patient as well. Okay, so just, I always like to know why I'm learning something. What's the point here? Okay. So, and we're gonna learn in pathology that something as simple as a canker sore can be indicative of something much bigger. Okay. So that is what is meant by a mirror of the human body. And like with cancer, changes in the oral cavity, something minor like a small lesion that you're going to find, could be indicative of something much bigger going on in the patient and beyond the oral cavity sometimes. Okay, so you've seen pictures like this before. We're going to be looking at them over and over again. When we talk about oral mucosa, we've talked a little bit about this before. The oral mucosa, for lack of a better way of putting it, is the wet stuff in your mouth, okay? We described labial mucosa. You can tell me what labial mucosa is. Samantha? Yes, it's that wet tissue around the inside of your lips. Why is it wet? Kelly?
The salivary glands are secreting.
That's right, the saliva glands are secreting saliva. And we have major and minor saliva glands. The minor ones are teeny tiny within the oral mucosa. Okay, and then we've identified the 3 major, and we'll be talking a lot more about that in chapter 11, or those in chapter 11. So we've talked about the labial mucosa. What about the buccal mucosa? What's that? Your name in the blue sweatshirt back there.
Haley.
Haley says, okay.
Yes, ma'am. It lines like the cheeks and it's, like the facial side of the.
Yes, good job. So it's continuous with the labial mucosa, right? And then we're also going to be talking about the mucosa that covers the palate, both the soft and hard. We're going to be talking about the underside of the tongue and then the floor of the mouth. And within each one of those structures, the composition of the epithelium as well as the connective tissue is different. So you might think that this is a tedious process. We're going to go through each structure and define all of those layers, but it's repetitive, so that means you're going to learn it. You're going to hear it again and again and again. So no sleeping, stay with me. We'll get through it. Okay, So we have talked about what stratified squamous epithelium is. Somebody tell me, what does stratified mean? Multiple layers of cells. What does squamous mean?
Flat and plate-like.
Flat plate-like cells. And does that mean that every layer of the epithelium is composed of squamous cells, Autumn? No, what does that mean? There could be, but why would we call it squamous then? That's exactly right. The superficial layer of tissue defines how we name it, right? Like the generic tissues that we talked about in chapter 8, we have a basement membrane that separates the epithelium from the connective tissue. We have that interdigitation that you can see here. But as we talk about these different structures, you're going to see that the level of interdigitation changes depending on where we are in the mouth. And by that I mean sometimes these ridges are flatter than others. So you need to pay attention to that as we go through, okay? And what does that mean if they're flatter?
Less,
Nissa?
less nutrients absorbed.
Could be less nutrients, so less surface area, but less strength. Okay, so the longer and more of those interdigitations there are, or those connections are, the more strength it gives to the tissues. Okay, and we said, generically speaking, or outside of the oral cavity at least, the two layers that we've identified as connective tissue, the loose or dense, combine to make up the connective tissue proper. In the oral cavity, we call those same layers the lamina propria. Okay, I know I said this 5 times, but they're new terms and I want to help you learn them, okay? So this is your basic model of oral mucosa. On the left is skin, on the right is oral mucosa. On the left we see connective tissue proper, on the right we see lamina propria. It is the same 2 layers, we just name them differently in the oral cavity, okay? And same names for the basement membrane, same names for the lamina propria, or the underlying connective tissue, okay? Nothing's changed yet. What are these things? No, but I'm glad you remembered that name. Haley? These are tonofilaments here, and since these structures are attached to acellular structures, what kind of structure is that? Jocelyn? Hemidesosomes, right? Hemidesosomes.
Can you repeat that? I'm sorry.
Yep.
You said it was.
These tonofilaments here are attaching the basal layer of the epithelium to the acellular layer here. And since it's cellular to acellular, these structures are hemidesmosomes. Okay, we're going to talk about 3 different types of oral mucosa. We're going to be talking about lining, masticatory, and specialized. And they have unique characteristics, and they're located in different places in the mouth, and you will need to know this. This is a nice chart to refer to. I'm not going to go through it now, but it's a good review of this lecture, basically. Okay? So when you're studying for the quiz or you're studying for test 2, this is a great reference. Yes, ma'am?
Do you know why the PowerPoint's not loading for us?
I don't, but I had trouble.
Okay, I like refreshed and everything, and I feel like nobody's is working.
Nobody's.
So I was
nobody's-
just gonna.
My
I tried. It's still saying it's got 30 minutes and 30 seconds left.
Mine, I tried downloading it and then it keeps kicking me out saying failed, and then it tries again and then it's like failed.
Have you tried turning off your computers and restarting them?
I logged all the way out, but I didn't come back in.
Okay, how about if we take a minute quietly to shut down your computer and then restart it? And if that doesn't work, you just need to follow along on the PowerPoint.
Could you go back one slide?
Sure.
For me? Sorry.
Yeah, no problem. But that's why, I guess that's why I had trouble with this one. Sorry? Yes. Yeah. We're gonna give it a minute, and if that doesn't work, I might run down and make copies of PowerPoint for you, okay? How are we doing? Nothing happening? No? Okay. Well, it's gonna take me a minute, but I want you to have something to take notes with. Keep it down, okay? Back short. I hope.
It's just like the little fibers in the back.
This is what I want.
This little hat. Showing how all the different things I mean, I guess it gets the job done, but I thought it was like a legit. I know. We all just stay together.
Oh, number one, that first one. Yeah. I don't think she's really sick. I would, I mean, I hope. Yeah,
she posts like, you can see, I was about to say.
I know,
I want it.
Yeah, you showed me that everything last time.
I didn't even put anything down. I literally did. I didn't even know where to begin.
Yeah, you like basic.
I was like, I didn't know what to do, but I didn't know where to start either, or like.
I couldn't even begin to say small. I don't know what they're doing about it because it's in such an awkward to do either one area. And I don't remember what you're saying specifically, so I just. You put which one? I think I put. I already know what I'm gonna do. No, these are my all natural babies.
They're naturally.
Yeah, they used to be a lot thicker. I'm really bad about using mascara for way too long. So like, like I know some people, like they're not like big and full. They used to be. They're like, I don't know how to explain it. I don't know what I'm talking about, but you know.
I don't understand how they
That's how my skin was. So mine is all like, which I have blonde hair, but my hair is like honestly very blonde. But they are all blonde hair, like blue eyes, and like no eyelashes, like little eyelashes. They do have those stick straight to them. Like I was bopping, like kind of. So all my friends are always like that's how you don't look like this. Yeah. For the fake ones.
But test 2 is over
Yeah, I think so, but it's not.
She's gonna throw some curveballs, alright?
But like, why she just said she doesn't want to do whatever on the material from the day before, 99 or 90. So like, that is so doesn't
My brother gets married too. First week in advance,
literally, I was kind of like, I would go into surgery and I would kill and like that is my I got dry sockets in all 4 of my holes, like, oh, it was just awful, and the worst. Dramatic, but I can't understand the crap I've never
Right here, birthday.
Was started to look down my application for this program. I never used it. I got it. And like, we did chapters and I was like, oh, this is easy. We got to 3 I don't know it. Yeah. Like chapters 1 and 2 were so smooth sailing. She bamboozled my ass but I'm very interested in what it I was literally just saying that. I was like, I honestly don't say it, but I know like she has to y'all all the time. Because we don't get
Everything transfers there. It's just so, look, I have 1, 2, 3, you go to this one. It's so amazing. I've been so long. I'm not even.
There's one girl, he's from Nashville. She thinks he's ugly. He's for real is beautiful. I don't know, but like he has all these pictures and it's apparently hard to think about it.
That is
Like, you can find yeah, and she was like, I've always wanted
I never have been well. No, literally, it was like, no.
I mean, that definitely sounds like I'll do it. When it comes to all these, like, do whatever. Do what you gotta do. Because I know you want to get worse than
It does suck working. Like, I don't mind working, but going directly to work, like, I started making it like, yeah. Do you work? you know, wake up every 2 hours. Yes.
So people are getting it in here.
Were you the one that said that, y'all did training? Like, do y'all do like training adults that are like not like?
So like, I learned they only like they let you talk about like every 2 hours. I'm like,
Do y'all like actually, I mean, besides like every 2 hours, does that sound like kind of like, like, do you actually enjoy it? Like, I think I would too. Yeah, that's what I'm saying.
and I don't agree with people. I don't
Yeah.
I can yell at them and they'll listen sometimes.
The reason why I asked is because my dog is so bad. Yeah, he's just like.
We show her that picture you have. Check it in on
know.
What is he? Oh my god, do you only have French kids?
I forget what it's
Who's like, Sarah?
But I can say like about me.
No.
He was standing on the couch looking at his phone.
Oh no. He's so cute though, but he is just, he's like an 80-pound puppy. He's like barely a year old. I think. We rescued him, like, but he's still, he's not like 99 or something. So like, he can barely know his own name. So they do a lot. He needs it. We like look at this so
Oh my god.
And she has his American old, already older. But literally, he's big, he's like, watch her. And the dog come up and sit right next to me. I will touch your dog with the eggs. Get it? Okay. And like the other day when we were in Mexico, like he was filling up water. And I ran and just dumped the water over. And my boyfriend ran. His dog was on the other side of the room and running full speed at me because he thought I jumped on the bed. And he was like running. I was like, that's crazy.
That's crazy. It's good like, to have that though, for like people who are actually like, you know, doing something like that.
Like, and then the other now I talk about it. But with others, so we're like, just like watching and you sit there and or just honestly.
See, I was trying to
I love it.
I need only to talk.
She did the other day. Yeah, she's very cool. This is both of them. This is more pictures I should have get a wedding. She found it. Actually, I think she gets or you just like you just gotta get there. That's all you gotta do. Once you get there, you start it back. And it is
Like they're actually y'all know when
now December.
I'm just gonna hope it's the best.
Yeah, but then the December before we
Yeah, the only thing that sucks is we have to do summer class. You know what? It's weird March for Christmas. I'd rather do a month for summer. That's what I'm saying. I'm like, I'm like, I don't care about being out for a month and fucking December. You know? I mean, I'm so pissed off. I'm like, why could you be in a month? All of our like, I don't want to be in my own regular time, sitting inside. Exactly, that's what I'm thinking. We did it for, no, literally, it's just like a break. I just don't want to do it. There's nothing to do. Like you said, I don't really have all my friends are like graduating and like doing other stuff. I'm like, hey, I'm gonna get you
Oh, I mean, I have a stepson who's an absolute nightmare sometimes. I love my
I said this thing when I'm recording.
I just don't know. I feel about it some way too. It's like, I mean, I'm in a social ministry. Like,
Copy number 29, the copy machine decided to,
That's, I have one already, so that's fine.
this was like watching the
is that one of
Any luck with the computers? No. Lisa, will you start that?
Yes. I need to take this.
Okay. All right, let's go. We lost some time. Okay. I I love lecturing, I love being with you ladies, but this kind of stuff I hate, it makes me very anxious. Sorry. Okay, so we said 3 types of mucosa in the oral cavity. We're gonna start with the one, pass it back. Oh. Really? Extras up here, anybody missing one? Okay. So, we are going to talk about 3 types of stratified squamous epithelium. Non-keratinized, orthokeratinized, parakeratinized. The functions of all of these types of epithelium, we talked about this yesterday. Barriers to pathogens. What are pathogens? Bacteria, say them louder. Viruses. Sorry? Well, pathogens are microscopic.
Oh, I thought you said what is the epithelium protect us from?
No.
Okay, my bad, my bad.
So, pathogens are disease-causing agents, including bacteria, viruses, fungi, and protozoa, okay? Protection against mechanical irritation. What kind of mechanical irritation would oral mucosa experience? There are lots of things. Devin?
Protection from our teeth.
Your teeth, that's right, when chewing. What else? How about toothbrushing? Okay, so there are a lot of them, but we'll start with those. Protection against dryness. Okay. So, we talked about 3 different types of oral mucosa. There are 3 types of epithelium that make up those 3 types of oral mucosa, and we listed both categories. So when we're talking about lining mucosa, which is our first topic of discussion, we're talking about non-keratinized epithelium. We talked about keratin a little bit yesterday. We said that keratin is a protein that gives strength to a structure. So when we're talking about lining mucosa, we're talking about epithelium without keratin. And lining mucosa has 3 layers. It has the single layer of cuboidal basal cells, it has an intermediate layer, and it has a superficial layer. And that's what we're going to talk about first. Some parts of the oral mucosa have cells called keratinocytes that produce keratin. Okay, and those would be in non-lining mucosa because lining mucosa does not have keratin in it. And we'll go over and over that. So in the other 2 types of oral mucosa, keratin is produced naturally in low amounts. When you have trauma, even to the lining mucosa that is non-keratinized, you are going to develop keratin. A good example of that is linea alba. That's a variant of normal we talked about. The linea alba is present on the buccal mucosa. Buccal mucosa is considered lining mucosa, which means that keratin that is present in the linea alba is not naturally occurring in the lining mucosa. That keratin was developed like a callus in another part of your body. Constant friction or trauma to that area resulted in the production of keratin in a non-keratinized tissue. Does that make sense? We'll keep talking. Okay, also present in epithelium are non-keratinocytes. these Grandstein and Langerhans cells are part of the immune system. The melanocytes we talked about produce melanin or pigmentation. Merkel cells are sensory organs that make oral mucosa responsive to touch. And then white blood cells. Yes, you need to know this list. These are cells present in oral epithelium. And here is a list and a description of all of those cells. Please review it. Okay, we've already talked about keratin. There's a term in your book when we're talking about the superficial layers of epithelium called microplicae. And I hate when a book brings up, this is the structure, but we don't really know what it's for. And this is one of those. It's kind of a ridge-like structure in the most superficial layers of epithelium. That's all you need to know about it. Okay? I'm not gonna lecture on it a bunch. This is probably it, but recognize that term for the board exam, so put stars around it on your notes. Okay, lining mucosa. We said lining mucosa does not contain keratin. As a result, the surface texture is softer than keratin containing epithelium. Example, put your tongue against your buccal mucosa and then compare it to the mucosa on your hard palate. Now obviously there's bone under your hard palate, but the mucosa itself on your buccal mucosa is much softer than the mucosa on your hard palate. That is because there's an absence of keratin. Remember, keratin gives a structure strength, so the feel of it is going to be different. We have moist surface on lining mucosa because of those tiny little minor salivary glands throughout your mouth. It has the ability to stretch and to be compressed. When we're talking about the buccal mucosa, that's important because that buccal mucosa is protecting your teeth from trauma. So the ability to stretch and be compressed is important. What of the collagen would assist with that stretchability? The elastic fibers, good. Also, the strength would come from the collagen fibers, so they're both present, okay? So, locations for lining mucosa, I've already referred to the buccal mucosa. Makes sense that the buccal mucosa and the labial mucosa would be both lining mucosa because they're connected to each other, they're continuous. Alveolar mucosa, who remembers where alveolar mucosa is? Kelly?
It's above the junction separating from the gingiva, so
Good.
it's right up there, the reddish
Yep,
part.
the more red gingiva area. So superior to the mucogingival junction on the maxilla, inferior to the mucogingival junction on the mandible. So it's the redder tissue surrounding the teeth. The mucosa lining the ventral surface of the tongue, so under the tongue, the floor of the mouth, and the soft palate. So these structures all consist of lining mucosa. Tissue with lining mucosa does not have keratin. That's the main takeaway here, okay? And this is just a review. So this is alveolar mucosa, non-keratinized. The attached gingiva, however, is a keratinized structure, okay? And that's in part responsible for the color difference that you see between those two tissues. Okay, now this is a great chart after you've read the chapter, after you've listened to me talk at you today, to review lining mucosa, where it's present. what is the constitution of the lamina propria? Is it thick, is it thin? And if you think about the locations of these structures, like the alveolar mucosa, that's very thin tissue. So you're not gonna have, if you just put your tongue on those areas, you don't have a big cushion there, do you? So that means that the lamina propria, or the underlying connective tissue, is barely existent. Whereas you've got fat in your cheeks, you've got thick underlying lamina propria to protect your teeth. Okay, so the amount of lamina propria deep to the epithelium and lining mucosa depends on the function of those structures. Is it protective? What is it doing? Okay? And then finally, deep to the lamina propria, we have the submucosa. And when we were looking at the skin, we said that that submucosa, or the hypodermis, had fat in it, right? Remember those yellow blobs? Again, depending on the structure we're talking about, the structures present within the submucosa changes. So that's the layout of this table. We're gonna go through each one of these structures and talk about all of this, okay? So, but this is a great summary for you to review. Okay, some general characteristics about lining mucosa. Remember when I said that those Reti ridges and papillary projections, the amount of waviness depends on where those structures are? This is what I'm talking about. With lining mucosa, you don't see the degree of waviness with that interdigitation. There's some, but not as much as the masticatory mucosa and the specialized mucosa, okay? We have elastic fibers in the lamina propria. We've talked about the reasons for that. And this tells us that the submucosa is usually present, but I'm thinking about alveolar mucosa, not a lot there, right? To allow for that compression, to act as a cushion. Good example, go back to the buccal mucosa. And then lining mucosa is often movable because the structures that include the lining mucosa are structures that we use for swallowing and speech. Think about the soft palate, think about the uvula, okay? That has to move to help us with speech and with swallowing. All right, some basic composition of lining mucosa. We have that basal layer, which is identifiable by that single layer of cuboidal cells. Deep to it is the basement membrane with those three layers that we talked about. And then we have one intermediate layer and one superficial layer. Super easy to remember. And this is actually the first picture in the activity that you're gonna have due for Friday that you're going to draw. It doesn't have to be perfect, but drawing this, labeling this will help you remember the layers and will help you. The activity is going to ask you to draw lining mucosa, I think orthokeratinized and parakeratinized tissue. And then you'll be asked to label all the layers. And don't forget, just because this, well, there isn't even a label for the basement membrane, you have to put that in there, okay? And then you'll be asked, and we'll go over the directions again, to put in all the structures that are made up of lining mucosa. We've already identified some, okay? So by drawing this, writing down those structures, this will help you remember. Okay, when we talk about regeneration of oral mucosa, of lining mucosa, we're talking about cell division happening here in the basal layer, just as it does everywhere else with epithelium, and traveling through the thickness of the lining mucosa, and then finally being shed. So cells inside your mouth, just like everywhere else in your body, are constantly being shed. what has to happen for these to be released?
Turnover.
Well, the time that it takes for the cells to move from here through here is turnover time. But what has to happen at a cellular level for those cells to be shed? Your name?
Shelby,
Shelby?
I was gonna say the wrong thing, I'm thinking of regeneration.
Okay. Okay. There's a structure that's keeping those cells together before they get to the most superficial layer. What is that structure? We made a list of structures that keep cells together. The desmosome. So remember we said before cells can be shed at the most superficial layer, there has to be a release of those desmosomes. Okay? So same process over and over again, no matter where we're talking in the body. The cell replication occurs in the basal layer, and then these newly formed cells travel through the more superficial layers till they finally get to the most superficial layer. In this case, it's nice and easy to remember, the superficial layer. And when it gets to that point, the desmosomes are releasing the cells, and then we get shedding. Okay? Now, what do you see just deep to the basement membrane? What are these structures? Those red things. Sorry?
Are they like fibrocells?
Well, they're underneath these red things. We said that there's no blood supply to the epithelium, no lymph supply. The epithelium relies on the underlying connective tissue for blood supply and lymph. These red structures are blood vessels. Okay, deep to that, you can see fibroblasts and the fibers, the elastic fibers or the collagen fibers. But these are blood vessels. And in this way, gases and nutrients diffuse into the epithelial tissue, and then the waste from the epithelial tissue diffuse back through that basement membrane and are picked up by the underlying blood vessels. Okay? So we have lamina propria. The more superficial layer of lamina propria is the loose tissue, and then we have dense tissue deep to it. And again, you notice that this interdigitation is not nearly as wavy as other slides we've looked at. That is typical in lining mucosa. Okay? Questions about this?
So
Lisa?
the purple is the reed ridges and the basal layer?
The purple,
Yeah, right there. That's the reed ridges, right?
well, the wavy lines are the rete ridges, yeah.
Okay.
Okay, and then these pink waves are the papillary projections. Okay. Then we have the intermediate layer. Again, the newly produced cells in the basal layer travel towards the superficial layer, and when they get to the intermediate layer, their shape changes. They're not as cuboidal, they start flattening out. Okay, they don't undergo mitosis in this layer, and this slide tells us this makes up the bulk of the thickness of epithelium. And then lastly, we have the superficial layer. They become more flattened, and so they're wider than in the intermediate layer. And at some point, they die. Those desmosomes release those cells, and they're shed. Okay? Yes, ma'am.
Are the collagen fibers beneath the blood vessels for this one, or because it's
They're
not in there?
intermingled.
Okay.
Yeah. Okay, so this is non-keratinized stratified squamous epithelium. Questions about this? already. So we know that the labial mucosa and the buccal mucosa, which are continuous, are formed from non-keratinized stratified squamous epithelium, and we call that tissue lining mucosa. Now you see a little bit of linea alba here. That is because there is friction on that buccal mucosa, which is lining mucosa, and it's like a callus. You know, when you have a shoe that doesn't fit great and it keeps rubbing, you get a callus or sometimes a blister. That callus is keratin, and it's a protective mechanism. And that's what linea alba is, okay? So keratin that's produced in a normally non-keratinized tissue. Okay? Yes, ma'am.
I was just moving my
Oh,
arm.
okay. Okay, also, within this basal layer, the melanocytes, so the cells that produce melanin, are present. And that release of melanin depends on race and sun exposure. Okay, so we know this. For labial and buccal mucosa, we saw where the vascular supply is, and as a result of that vascular supply, the tissue looks pink. Okay, makes perfect sense. And the lamina propria contains collagen and elastic fibers, so it gives lining mucosa strength and elasticity. So when you smile, you're able to do so because of the collagen fibers, right? And the elastic fibers. The submucosa contains adipose tissue. We know that. We can feel the fat in our cheeks. And this says that the submucosa is firmly attached to the underlying muscles of mastication. Okay, what would happen if it weren't? We would have food flying all over the place when we ate. Okay, variants of normal we've talked about before. The Fordyce spots on buccal mucosa and sometimes at the labial commissure. We said they're deposits of oil or fat, and this slide tells us that those deposits come from the submucosa layer. And we've already talked about hyperkeratinization. Also, people who have a grinding habit tend to have more pronounced linea alba than those who don't. So if you have a patient who has a very pronounced set of linea alba and you see wear on their teeth, you're gonna ask them, are you a grinder or a clencher? Okay, so remember this. Linea alba is keratinization that occurs in a non-keratinized tissue as a result of trauma. Okay, who has heard of snuff keratosis or tobacco keratosis? Anybody know anybody who dips? Okay, so a common clinical manifestation of that habit is a white patch, a little tough to see, but it looks like corrugated cardboard. And there are other clues here that this patient dips, the stain on the teeth, okay? So on the health history, there is a section of social history where patients ask about habits like that. Sometimes they're not willing to admit, but in this case, it's pretty obvious. When you see a white patch like this in tissue, again, this is labial mucosa, right? We wouldn't expect to see keratin in that. But when you see evidence of stain like that, this is a classic place to put the tobacco. And again, the whiteness looks kind of like corrugated cardboard. You can bet they have that habit. And we call that snuff snuff dippers or dippers keratosis, okay? With something like that, you would have to definitely put this in the patient's record. There's a way to describe lesions that we're gonna learn next quarter, and you would do that, possibly take a picture, and certainly talk to the patient about discontinuing this habit, because it very definitely can become a precancerous or a cancerous lesion if it's not already. Okay? A good friend of mine, a hygienist, has a husband who has that habit, and he lost half of his jaw. Okay. Alveolar mucosa. We already looked at pictures of alveolar mucosa. We said that we identified the location, and we said alveolar mucosa is much redder than the attached gingiva, so it's very easy to identify. We know that it's wet, so it's shiny and moist and is somewhat mobile and covers alveolar bone. All things that you know, right? Non-keratinized, we know that because it is lining mucosa, and lining mucosa is non-keratinized. This is what it looks like microscopically. Not a great takeaway there. So, what would you say in terms of the lamina propria in the area of alveolar mucosa? Tell me your name.
It's thin.
It's thin. Yep. Seems like there's a little bit of lining mucosa and bam, you get into bone, right? Here's another picture of it. Okay, we're moving on to the ventral surface of the tongue. What is ventral mean? Underneath, right? Again, lining mucosa, not typically containing keratin. I have not seen a tongue with trauma to it that has keratin on the underneath, on the underside. So that would be very unusual. The vascular area is pretty obvious. We have some very prominent veins. It's always going to be moist because of all the saliva. We've got the caruncles on the floor of the mouth opposing the ventral aspect of the tongue. Okay, break time. Whitney?
You have a question? I actually forgot I submitted this to you.
It was a little bit ago, wasn't it?
It was. So this picture on the right is me and my boyfriend Carlton. We've been together for 7 years. That's at Opryland. We had never been to Opryland till this Christmas.
Okay,
So that was our first trip.
nice.
Down here, this is my dad and my younger brother Peyton. My dad's name is Ray. He has his own business, so I've kind of grown up in a body shop my
Okay.
whole life. So we're very close. This was at my surprise birthday party that he threw me a
Nice.
few years ago. And then this over here is my second family. I've literally been with these girls every day of my life since I
Wow.
was 7.
Nice.
Yes, they are my very, very close friends. I'm actually related to half of them, and it's ridiculous. These two beside me, I'm on the left, those two are my cousins, and then the other one on the end is also my cousin.
Okay.
And then my ball coach is also my cousin and my preacher.
Okay.
Very close.
That's great.
It is.
Okay. Now I can't remember. Do you still play?
I do
Okay.
still play. I don't play as much. COVID kind of knocked it out
Yeah.
for a little bit, but they're starting back up this summer, so I'm hoping to
Good.
travel a little bit. Yeah.
Good. And what position do you play?
I'm a catcher.
Okay.
I've been a catcher since I was 8,
Wow.
so I actually lost all 4 of these front teeth.
I got hit in the face with a bat. It was really bad.
Oh,
I wasn't paying, I was just young. You know how you're young and you don't really pay attention? So I just threw my little helmet off and the little girl took off running and threw her bat and it just
wow.
shattered all of them. So,
Wow. So you're gonna be a great one to promote mouth guards and all the safety equipment for kids who play sports, right?
Yes,
Okay.
100% because it changed my life.
Sure it
Not to
did.
be dramatic, but it did. I didn't get my permanent teeth till high school.
Wow.
Like till I turned 15 and they took forever to come in and so it was just a big
So these
mess.
were primary teeth that were knocked out?
Yes.
Okay.
Thank goodness.
Yeah.
So,
Okay.
but yes, I guess just to wrap it up, I've traveled to like 13 states with these girls
Wow.
and we've played over 350 tournaments together, like different areas, so it's pretty cool. It's just
Good.
nice to like travel with everybody and get really close to
No.
your family, so.
Good. Nice. Well, thank you.
You're
Okay, back to the floor of the mouth. So remember these structures, we've got the frenum, we've got the sublingual folds. What are the sublingual folds? What are they? What's underneath the tissue? The carnuncles are right here on either side of the folds. Tell me your name.
Emma.
Emma.
Is it the Wharton and the
Yes, and the Wharton stuffs, yep. So we have lining mucosa covering those folds and all the structures surrounding it, okay? Emma just told us this. So once again, non-keratinized. The lamina propria has a big blood supply presence there. And we have elastic fibers there, not surprising. That's how we're able to move our tongue, right? The connection to the floor of the mouth, and we have some minor salivary glands within or deep to the lamina propria, okay? The submucosa is thin but firmly attached to the underlying muscle, which is helpful because once again, we want a tongue that can help us speak and swallow. And this tells us that the muscles and the mucosa function as one unit during mastication and speech. Okay, makes sense, right? Important, put stars around this. In the floor of the mouth, the submucosa contains the submandibular and the sublingual salivary glands. Are you missing something, Samantha? Okay, and as a result of both minor glands and those two major salivary glands, not surprising, the area is moist, compressible, and this says loosely attached. Again, we're talking about submucosa to the underlying bone and muscles. So there needs to be some flexibility for tongue movement, right? So that's what this is all about. We talked about mandibular tori. They are covered with lining mucosa. And we've also talked about ankyloglossia, which is tongue-tied, or a frenum that has a very tight attachment to the tongue and tends to be more near the apex of the tongue. And we said over time that can loosen, or if it doesn't and it's causing the patient a problem with swallowing or speech, it can be clipped. Okay? Released. Soft palate. What's the function of the soft palate?
Doesn't it keep food from going or something?
Yeah, exactly. So when we swallow, it lifts and closes off the nasopharynx so that we don't aspirate food and drink. So given that, kind of makes sense that it is different from the more anterior hard palate covering, right? Needs to be a lot more flexible. It needs to move when we do that. In fact, when it does that, it creates a vacuum in our mouth. Okay, so it needs to be very flexible. So you can imagine that we're gonna have elastic fibers in that lamina propria, right? So when you look in someone's mouth, the way to distinguish hard palate from soft palate is that there's a color change. It is, the soft palate is yellower or lighter in color typically than the hard palate. To me, it looks orange, that line of demarcation. But there is a very distinct color change, and that is due to the different compositions of those structures. The hard palate is considered masticatory line, or masticatory mucosa. The soft palate is lining mucosa.
Do you have to know those for the quiz?
We're not having a quiz tomorrow. We got 2 delayed today. We'll do it Monday. Okay? Yeah, you should know the difference between soft palate and hard palate. Are we happy about this? Okay. Well, I'm here to make you happy. Most days, right? Did somebody have a question here?
Real quick, is the quiz over the end of chapter 6 to what we get through today?
Yeah.
Alright.
No, maybe probably tomorrow.
Tomorrow.
Tomorrow. No, what we get through tomorrow. So we will finish chapter 9, and I'm hoping we can start on 11, which is short. It's on salivary glands. I'm hoping.
But the schedule you talked about this morning is about the exams is still.
Yeah, we don't have a lot of leeway.
Okay, I'll just make it.
Yeah. Yes, ma'am.
Are we supposed to read chapter 10 on our own? Did I miss that?
No.
Okay, sorry.
No, you will get a lot about gingiva in your perio class.
Okay.
So given the time limitations, no sense in duplicating that, okay? Okay, I think we're just about ready to stop, but let's finish the soft palate, okay? So, soft palate, the epithelium itself is thin, it's not keratinized, it is overlying a thick lamina propria. Makes sense, right? And we said that because of its function, the fact that it has to lift, we're gonna see some elastic fibers present in the lamina propria. So hopefully you don't have to do a lot of memorizing. A lot of this stuff, if you think about what these structures do, it makes sense. The structure makes sense, right? And the submucosa, it has firm attachments to the underlying muscle for speech and swallowing. That also makes sense, right? And not surprising, the submucosa contains fat tissue and salivary glands, okay? One of the things that you're going to learn in pathology, and yes, you need to know this for the upcoming quiz, is that canker sores or aphthous ulcers, which the etiology we don't know, in other words, what causes these aphthous ulcers, but they only occur on lining mucosa. So as a clinician, if you see an ulcer like this, or like this one's hard to see, and it's on the lining mucosa, that is a clue that it's a canker sore. If you see a lesion like this that is on the hard palate, or maybe on surrounding skin, it's not a canker sore, okay? They only affect lining mucosa. You've heard the term canker sore before. How many of you have had one? You know how miserable they can be. Yes, ma'am? Uh-huh.
Does the image on the left look similar? I bite like the inner part right here,
Uh-huh,
a lot,
yeah,
but it makes something similar like that, where like I eat that first layer, basically, I
Okay.
chew it from anxiety instead of my nails.
but does, well, that's
It's
good,
not
I
the
guess.
same thing though, right?
No. This is a sore, and we'll define exactly what that lesion is, but no, this is an ulcer. And usually things like stress or sometimes spicy foods, citrus can bring those on, or at the very least aggravate them. Comments?
So are they only on the mandibular or can they also?
No, they can be on the buccal mucosa, they can be on the soft palate, anywhere there's lining mucosa, okay? So, good review table, take a look at this. So tonight, this is about, we're done with lining mucosa. Tonight, I would like you to take a look at activity 6, I think it is. Just bear with me a minute. Okay, activity 6. All right, the directions say draw the cell layers from the outermost epithelial layer to the submucosa, including the basement membrane for the following types of oral mucosa. The first one is non-keratinized. That's what you just looked at. Okay, that is lining mucosa. So you are going to draw yourself, I was gonna say me, but this is for yourself, a picture of all of the layers present in that type of mucosa. That includes the 3 layers of the basement membrane. That includes the 3 layers of the epithelium, which are the basal cells, the intermediate layer, and the superficial layer, okay? And then you are to draw the lamina propria and the appropriate submucosa. You can refer to your book, okay? Then the second part of this is you label each layer. The third part of this is you're going to list the structures in the oral cavity that are of this type of mucosa. So if I were you, while the material's fresh, and to reduce the amount of work you have Thursday, because this is due Friday, I would get this picture done. And then tomorrow we'll talk about the orthokeratinized and the parakeratinized.
Do we take a picture on our phone and then like, look what we drew, or we?
Well, some of you have trouble sending me pictures, so, I am thinking that it might be best to turn in the hard copy or paper copy. You can use colored pencils, you can use highlighters, okay? But this is not for me, this is to help you review this material, okay? So I'll give it back to you, I just wanna make sure you get it. Okay, so I'm giving you points for you to study. That's what this is about. Okay, so do a good job on it, and think about it when you're doing it. Yeah.